If you've had a COVID-19 vaccine, it's still important to come in for your mammogram, regardless if you're having symptoms or not. If it's time for your annual mammogram, definitely come in and get screened as you normally would. Just let your provider know, your mammogram technologist know that you've had the vaccine and which arm it was administered in. Breast cancer can sometimes present, or certainly present with, lymph nodes that are swollen under one arm. And so when we see that on a mammogram, we always want to evaluate that further and make sure that this is related to the vaccine and not to a breast cancer. Women should get their COVID-19 vaccine even if they're scheduled to have their mammogram. We are not seeing swelling in the lymph nodes in every woman that has the vaccine and then has their mammogram. And so we definitely want to continue screening as we normally would, whether you get the vaccine or not. If you are receiving treatment for a breast cancer diagnosis, it's very important to protect yourself from the COVID-19. One thing that you can do is certainly get vaccinated. And the next thing you can do is what is important for all of us still is to wear masks when in public, social distance, and to wash your hands. We are seeing guidelines that say women at any stage of breast cancer treatment should be vaccinated if able. It's important not to delay screening for breast cancer or receiving care for breast cancer if you've been diagnosed in any circumstance, whether we're in the pandemic or not. Because breast cancer, when it's found and treated small and early stages, it is almost curable, essentially, certainly much more treatable than if we discover it at later stages or at larger sizes. And so for that reason, regardless of what's happening in the world around us, it's really important to not delay your breast cancer screening.